हम वो बीच पे रख लेना, तुम उसको तो। हेलो, मैं डॉक्टर बैनर्जी बोल रहा हूँ जबलपुर से, और ये हमारा 48th जर्नल क्लब है विथ आवर न्यू फेलोज. They will introduce themselves. Please go ahead.
Hello, I'm Dr. Shalini Agrawal, MBBS MS in ObGyn. We joined Ideal in Fertility Center 2 weeks back. And
hi, I'm Dr. Neha Agrawal. I'm DGO DNB and I'm here as a fellow in reproductive medicine.
So this is our new session with these two bright girls, and today their first journal club, and they will be presenting. Shalini will present on steroidogenesis and Neha will present on two-cell tumor theory. I request Shalini to start her lecture. नेहा बैठ, अभी इसको क्या करना वो कर. Start. Join.
Recording in progress.
वो लिखना कैसे हो सकता है?
good evening, everyone. I'm Dr. Shalini Agrawal. Today we will talk about steroid. What is steroid? Type of steroid and production in ovary and adrenal gland. All steroid hormones are of basically similar structure with relatively minor chemical differences leading to striking alteration in biochemical activity. So, what is this basic similar structure? Okay, here, what is this? This is one benzene ring. If I add one more benzene ring, then it's become naphthalene. If I add one more benzene ring, then it's called phenanthrene. If I add one penta ring here, then it's called cyclopentanophenanthrene. It is the basic nucleus of any steroid compound. If I'll add some chains here and make it 27 carbon compounds, it's become cholesterol. What is cholesterol? Cholesterol is a parent unit. By this, we derive other cholesterol. So the other line, the next line is the minor changes, the minor differences leading to striking alteration. What are these minor changes? The sex steroids are divided into 3 main groups according to number of carbon atom they possess. The first nuclear group is pregnant nucleus. The second is aldosterone nucleus, and third is estrone nucleus. What is this pregnant nucleus? This pregnant nucleus is 21 carbon compound and includes corticoids and progestins. The androsten is 19 carbon compound and it includes androgens. The third is estrone. Estrone is 18 carbon compound and possess estrogens. How we will make this 21 carbon compound, 19 carbon compound and 18 carbon compound? So we have a parent carbon compound which is 27 carbon compound. Cholesterol. Cholesterol is 27 carbon compound. So we have to make a new carbon compound which is 21 carbon compound. So from 27 carbon compound we need 21 carbon. So we have to remove some carbons So we have to remove some carbons. We have to break here, break this chain, then only we can get 21 carbon compound. In any reaction, if we have to remove some carbon compounds, we need enzyme. So here we require one enzyme called desmolase or lyase. In any reaction, if we have to remove carbon atoms or side chain, we need enzyme, and always this enzyme is desmolase or lyase. But the name will different. Here we will call it 20 to 22 desmolase because we are using it here. Now it will become 21 carbon compound and we will call it pregnant derivatives or pregnant nucleus. Now we have to make 19 carbon compound. Again, we have to remove some carbons. If we have to remove some carbons, we have to use again this enzyme desmolase. Now, where we will use this desmolase enzyme? Here. Because this is 18, this is 19, this is 17. So we have to remove here. Now we will call this enzyme 1720 desmolase or 1720 lyase. Now we have to make 18 carbon compound. So again we have to remove one carbon. So now we will remove this carbon here. And again we'll use one enzyme. This enzyme will be desmolase or ligase. Now we will call 19 desmolase or 19 lyase. What is delta 4 and what is delta 5 compound? Delta 4 compounds, see. See, this is one benzene ring. This is other benzene ring. If we'll number it, 10. We all know benzene ring have some double bonds. Okay? If this double bond present between carbon number 4 to 5, what we will call it? Delta 4 carbon compound. And if the double bond present between 5 to 6, we will call this delta 5 compound. So delta 4 compound and delta 5 compound, they are isomers of each others. So if they are isomers of each other, if I want to convert delta 4 compound to delta 5 compound, again I will need one enzyme. So what will that enzyme? Isomerase, because they are their isomers. Okay? And one more thing, delta 4 compound are more potent than the delta 5 compound. Okay? See, steroid structure is like a plate-like structure. See, plate-like structure, if we add one OH group or one ketone group upside in any carbon atom, if we have to add, if we'll add some OH group or hydroxyl group, yeah, any group, if we'll add upside, it's called beta position. मान लीजिए this is the first carbon compound, so and we'll add OH, then what we'll call 1 beta hydroxy. Yeah, 1 beta all. We will call 1 beta all. And if we'll add downwards, it's called alpha carbon, and we'll denote it by a dotted line. Why it is necessary to read about alpha carbon and beta carbon? Because some alpha products or some beta products are active, inactive. So for seeing which by changing their sites, only alpha and beta, they become active or they become inactive. Before we study steroidogenesis cycle, we have to read some and we have to discuss about some enzyme or some reaction. The first reaction is desmolase reaction. I have already told about this reaction. If we have to break some side chain, we need one enzyme desmolase, and this reaction is called desmolase enzyme, desmolase reaction. And second is, if we'll convert OH group to ketone group or ketone group to OH group, we need one enzyme. Here, this enzyme will be dehydrogenase and reaction will be dehydrogenase reaction. The third is, if we are adding hydroxy group in on carbon atom, this is hydroxylation reaction and enzyme will be hydroxylase. In whole steroidogenesis will depend on these enzymes. Now we will start steroidogenesis. This will occur in ovary, in theca cell and in the granulosa cell. So we'll start with the parent compound. So what is our parent compound? Cholesterol. Cholesterol is our parent compound and number carbon atom 27. So of a next product, what is our next product is pregnenolone. Pregnenolone, अगर हम इसके कंपाउंड का नाम बोलें तो what is this? 3 alpha hydroxy 20 pregnenolone. So here this is 21 carbon compound, this is 21 carbon compound. So we need to remove some side chains. So what enzyme we will need? Desmolase, right? So this is desmolase enzyme, and there is a OH group and one ketone group. Ketone group in 21st carbon. In 21st carbon we add one ketone group. In 20th carbon we add one ketone group. So this is 3 beta hydroxy. 3 beta क्यों? Because we add in downside. So 3 beta hydroxy 20 pregnenolone. An enzyme we use 22 desmolase. The next reaction is, the next product is 17 hydroxy, and what is this? This is delta 5 compound, because this is 5, this is 6. Where is double bond between 5 to 6? This is delta 4 compound. Now next product is 17 hydroxy pregnenolone. 17 hydroxy, अगर हम नाम को समझें, 17 on 17 position of a compound. So what is our 17 position? This is our 17 position. And what we are adding? Hydroxy group. Hydroxy group. So we added one hydroxy group. See, so what is this? 17 hydroxy pregnenolone. So मैंने क्या बताया? If there is we are adding hydroxy group. So what enzyme we will use? Hydroxylase. And where we are using? In 17 position. So what is this? 17 alpha hydroxylase. Why alpha? Because we are using in downward position. Then we can see the dotted line also. Okay. Now next and this is also delta 5, because this is 5 and this is 6. The next product is dehydroepiandrosterone. Dehydroepiandrosterone. So this is 21 carbon. And aldosterone, obviously this is 19 carbon compound. So again we have to remove some chains. So again we have to remove some chains. So enzyme will use desmolase, and it's called 1720 desmolase. The product will form, if we'll go to a chemical formula of this name, dehydroepiandrosterone, it's 3 beta hydroxy 17 epiandrosterone. Why? 3 beta. This is 1, this is 2, this is 3. So 3 in beta position, hydroxy group. Okay, so 3 hydroxy beta. Now in 17 position, there is one ketone group. So 17 epiandrosterone. And this is also a delta 5 compound. Now this delta 5 compound will convert into delta 4 compound. See, this is 1, this is 2, this is 3, this is 4, and this is 5. Now double bond shifted from here to here. So now this is delta 4 compound. The enzyme will use isomerase, because they are isomerase. And we are seeing in third position there is OH group, but now there is ketone group. तो अगर ketone group से OH group हम convert कर रहे हैं, enzyme कौन सा लगाएंगे? डिहाइड्रोजनेस। और किस पोजीशन पे कर रहे हैं? थर्ड पोजीशन पे कर रहे हैं। किस साइड कर रहे हैं? बीटा साइड कर रहे हैं। तो एंजाइम विल बी 3 बीटा हाइड्रोक्सी स्टेरॉइड डिहाइड्रोजनेस। ओके, द प्रोडक्ट विल बी एंडोस्टेंडायोन। ठीक है, एंडोस्टेंडायोन विल आल्सो बी डेल्टा 4, राइट? नाउ विल गो टू दिस साइड। ये था प्रेगनेनोलोन। प्रेगनेनोलोन is 21 carbon. This is also 21 carbon. This is also 21 carbon. This is and this is here is OH group. Here is OH group and here is ketone group. So again we are converting OH group to ketone group. Enzyme will again what enzyme will again use? Dehydrogenase. And which position? In third position. Which side? Up side. So 3 beta hydroxy steroid dehydrogenase, and the product will form progesterone. Why this is on? Why there is on? Because this is ketone group. The ketone group is on dione, trione. If there is OH group, this is all diol, triol. Now the next product is 17 hydroxyprogesterone. 17 hydroxyprogesterone, we are seeing, we are adding in 17 position 1 OH group. If we are adding 1 OH group, then we are doing hydroxylation. If we are doing hydroxylation, what enzyme will we use? Hydroxylase. Simple. And which position? In 17 position. Which side? Alpha side. So 17 alpha hydroxylase. And product will be 17 hydroxyprogesterone. But the important cheese is here, this is delta 4 compound, delta 5 compound, and this is delta 4 compound. तो ये थोड़ा सा गलत है, this is isomerase. ठीक है, तो एंजाइम कौन सा यूज किया हमने? delta 4 to delta 5 isomerase. So now this product will be delta 4 compound, and we can see this is 4th number, this is 5th number, delta 4 compound, and this is also delta 4 compound. So this delta 4 compound are more potent than the delta 5 compound. Now again we can see this is 21 carbon. Now this is 19 carbon. So we have to remove some carbons. If we are removing some carbons, which enzyme we use? Desmolase. And desmolase 1720 desmolase, because we have to break from here. यहाँ क्या लिखा है? 17. यहाँ क्या लिखा है? 20. Simple. 720 desmolase. ठीक है. Now we get which product? Androstenedione. Till here, this process occurred in theca cells. Theca cell transfers androstenedione to the granulosa cells, because the granulosa cell does not have their own blood supply. अगर उनके पास ब्लड नहीं होगा तो उनके पास कोलेस्ट्रॉल नहीं आएगा. कोलेस्ट्रॉल नहीं आएगा तो ये सब कैसे होगा? Right? The theca cell only blood supply, so they get cholesterol, they get all these reactions. So this androstenedione shifted to granulosa cells. Now this granulosa cell have a very unique enzyme called aromatase. ये aromatase enzyme convert androstenedione to estrogen. ये तो अच्छे से दिख नहीं रहा है, बट अगर अपन देखें तो ईस्ट्रोन में क्या है? 1 ketone group on 17th and 1 OH group on 3rd, right? And here this androstenedione is converted into testosterone. This testosterone convert this androstenedione with the same enzyme aromatase. So here we can see there is a 2 OH group, and here there is only 1 OH group. So this is on estron, and here's 2, so this is dione, and if it is 3, this is trione. So here, this cycle occurred in adrenal gland. So adrenal gland has 3 parts. First, granulosa. Second, fasciculata. And third is reticularis. In granulosa, mineralocorticoids are glomerulosa. इसमें क्या बनता है? mineralocorticoids. मिनरलोकॉर्टिकॉइड्स मतलब एल्डोस्टेरॉन. एंड नेक्स्ट इज फेसिकुलेटा. फेसिकुलेटा में क्या बनता है? कॉर्टिसोल. एंड थर्ड इज रेटिकुलरिस. रेटिकुलरिस में क्या बनता है? सेक्स स्टेरॉइड्स. सो व्हाट इज द डिफरेंस बिटवीन एड्रिनल ग्लैंड एंड ओवरी? ये सब तो ओवरी में भी हो सकता था, क्यों नहीं हो रहा ओवरी में? क्यों ओवरी में क्यों नहीं हो रहा? क्योंकि ओवरी डज नॉट हैव दीज टू एंजाइम विच आर 21 हाइड्रोक्सिलेज एंड 11 बीटा हाइड्रोक्सिलेज. तो अगर ये एंजाइम नहीं होंगे तो ये प्रोसेस नीचे की जाने की जगह सीधे जाएगी, ये प्रोसेस इधर जाने की जगह सीधे जाएगी. तो इसीलिए ओवरी में क्या नहीं बनता? एल्डोस्टेरॉन नहीं बनता. क्या नहीं बनता? कॉर्टिसोल नहीं बनता. और क्या बनता है? ये बनता है, क्योंकि उसके पास ये एंजाइम्स हैं, बाकी एंजाइम्स उसके पास नहीं है. तो अगर हम देखें हियर, this 17 hydroxy pregnenolone is also converting in 17 hydroxy progesterone. अगर हम इसके स्ट्रक्चर्स देखें, अगर हम इसका स्ट्रक्चर देखें तो व्हाट इज दिस स्ट्रक्चर? 17 hydroxy pregnenolone is converted into here 17 hydroxy progesterone. क्या डिफरेंस है दोनों में? Here we can see in third position there is OH group, and here in third position there is one ketone group. Only these are the difference. So by this it is, so what we are doing, we are converting OH group into ketone group. So which enzyme? Dehydrogenase enzyme. So which enzyme? Dehydrogenase enzyme. In which position? Third position. तो 3 in which side? Upside. तो 3 beta hydroxy steroid dehydrogenase. Very simple. अब यहां पे भी हमने क्या किया? यहां पे भी हमने एक OH ग्रुप इसमें ऐड कर दिया, तो वही एंजाइम लगेगा 3 beta hydroxy steroid dehydrogenase. एंड सेम विथ हियर. अगर हम इसको, अगर एड्रिनल ग्लैंड में हम देखते हैं और हमारे पास 21 हाइड्रोक्सिलेज और 11 बीटा हाइड्रोक्सिलेज एंजाइम है, तो दिस प्रोजेस्टेरॉन विल कन्वर्ट इनटू deoxycorticosterone and by the help of 21 hydroxylase. This convert into corticosterone with the help of 11 beta hydroxylase. This convert into 18 hydroxycorticosterone with the help of 18 hydroxylase. This convert into aldosterone 18 oxidase. And here, by the help of 21 hydroxylase and 11 beta hydroxylase, we'll get cortisol. So, any question or any query? So,
If you go back,
yes, sir.
so if in this side, if
This side.
21 hydroxylase is absent, suppose,
Yes, sir.
then the equation will go in which direction?
If sir is saying कि if we don't have this, right?
Yes.
We don't have this. So if we don't have this, so we don't have this also.
Yes. Very good.
Got it? So I don't think I have to say this, but there is only one direction. There's a one arrow only. This direction, and this direction. So patient does not have these two hormones. Which hormone? Cortisol and aldosterone.
Will be missing.
Will be missing, sir.
And patient will go to the testosterone side.
Testosterone side, sir.
So the lady, if the girl is not having 21 hydroxylase,
Yes, sir.
then
So then testosterone will increase, and the patient will show male symptoms like virilization, hirsutism, hoarseness of voice, and
more in hirsutism.
Yeah.
Okay. So that means this is 21 hydroxylase. If you have gone through very nicely, no doubt about that. But the thing is, if 21 hydroxylase is absent,
yes, sir.
in which condition we have discussed about that, when 21 hydroxylase is absent in any condition?
Congenital adrenal hyperplasia.
So what happens if there is no aldosterone or cortisol? There will be no negative feedback.
No negative feedback. There is a no negative feedback. So there is a more and more production of
ACTH.
ACTH and more
production
production of testosterone will increase.
So ACTH will create
positive feedback, मतलब
तो
hyperplasia of the adrenal gland.
So the condition is called
Congenital adrenal hyperplasia, sir.
So if the baby is born with the congenital adrenal hyperplasia,
Yes, sir.
the newborn might be with no aldosterone or cortisol.
Yes.
So there will be salt wasting.
Yes, salt wasting, sir.
And it will be a grave situation.
Yes, sir.
And if it is late onset, then there will be higher amount of
testosterone.
So any higher amount of testosterone in any other differential diagnosis in hirsutism, which is very common, PCOD. So if anybody comes with PCOD, we should think about
this also, sir.
This also. There
Yes,
should
sir.
be a differential.
Yes, sir.
I think
thank you so much.
Shalini has covered the thing very nicely. And
if anybody wants to reference, so I prepared this thing from the Sorry, Sparrow. Okay, thank you so much.
Very nicely presented.
Thank you so much.
And it is my pleasure to call Neha now. She will be talking on two-cell to gonadotropin theory, and basically she will be covering what is the role of granulosa cell and theca cell. So till things are being prepared, this is our fellowship program, which is started from 9th of February this academic year, and Shalini and Neha have joined, and they have fantastic. This presentation is good, and we will continue for every 15 days. They will put this seminar, and we will try that they can go with good success in their life. Please go ahead, Neha.
Thank you, sir. I am Dr. Neha Agrawal. Today I will be talking about two-cell to gonadotropin theory in menstrual cycle. So as we all know that menstrual cycle is divided into three phases: the follicular phase, the ovulatory phase, and the luteal phase, in which there is development of corpus luteum. So the follicular phase is an orderly sequence of events in which there is selection of a single follicle, which is called as dominant follicle, and it takes place over 10 to 14 days. It comprises initial growth from a primordial follicle through the pre-antral and antral stages. Now, what is primordial follicle? This diagram is showing the structure of primordial follicle. Primordial follicle has a germ cell in the center, which is arrested in the diplotin stage of the meiotic prophase, and then it is surrounded by a flat layer of granulosa cell. Primordial germ cell originate in the endoderm of the yolk sac, allantois, and the hindgut. Then by 5-6 weeks of gestation, all these germ cells will migrate to a gonadal ridge in the center of the embryo. And at around 6 to 8 weeks, there will be mitotic multiplication of the germ cells. This multiplication of the germ cells will continue till 20 weeks of gestation. So at around 16 to 20 weeks of gestation, the oocytes are maximum in number, around 6 to 7 million. Thereafter, from the maximum number of oocytes at 16 to 20 weeks, there will be gradual fall of oocytes, which will continue throughout the life cycle of the woman. This process of follicular growth and atresia is a dynamic process, and it is not interrupted by pregnancy, ovulation, or any period of anovulation. So the final number of oocytes achieved at birth is around 2 million, which then decreases to around 3 lakhs at puberty, and finally only about 400 follicles will ovulate during a woman's entire reproductive lifespan. Now, the first visible sign of follicular development is increase in the size of the oocyte and lining of the oocyte, that is the granulosa cell. It will convert from squamous to cuboidal. Also, there is development of small gap junctions between the granulosa cell and the oocytes. Here we can see the diagram showing primary follicle. This germ cell is surrounded by a thick layer of glycoprotein, which is called as the zona pellucida. And around this, there is a single layer of cuboidal cell, the granulosa cells. In the pre-antral stage, what happens is the granulosa cell proliferate under the effect of estrogen, and the outer layer of stromal cells get organized into a layer called as theca cells. These granulosa cells and the theca cells are separated by a membrane which is called as basal membrane or basal lamina. Also, there is development of FSH receptors on the granulosa cell. This FSH has two functions. It stimulates granulosa proliferation and it also activates aromatization, that is the production of estrogen. Now, what is important here is not all the cells, all the granulosa cells have got this FSH receptor. Only the surface cell are having the receptor, and those cells which have the receptor transfer the signal by gap junction to the inner cells. So this hormone initiated action can be transmitted throughout the follicle, even those only a part of the cells bind to the hormone. Now the next stage is the antral stage, in which there is increased production of follicular fluid under the effect of estrogen and FSH. This follicular fluid will coalesce to form a cavity which is called as antrum. And the granulosa cells which are around the oocyte, they are now called as cumulus oophorus. The theca cells outside, they also get divided into two parts. The inner cell are called as theca interna and the outer cell are called as theca externa. This follicular fluid is rich in hormones, growth factors and cytokines, which provides a milieu that is required for the orderly maturation and development of the oocyte. In the presence of FSH, the estrogen is the prominent hormone present in the follicular fluid, and in the absence of FSH, androgens will predominate. Usually at this stage, LH is not identified in the follicular fluid. But if LH is prematurely elevated, then it will inhibit the mitotic division of the granulosa cell, and which will eventually cause the degeneration of the oocyte. Now, what is a healthy oocyte? Healthy oocyte is a oocyte which has a more estrogen content and the lowest androgen and estrogen ratio. Now, coming to the two-cell, two-gonadotropin theory, it states that the production of estrogen and androgen is divided into two compartments. One compartment is the theca cell and the other compartment is the granulosa cell. The FSH receptors are only present in the granulosa cell and the LH receptors are only present in the theca cells. Also, the enzyme content of both the cells differ. The theca cells have the P450 side chain cleavage enzyme or the lyase enzyme, which converts cholesterol to pregnenolone. And also the P415C17 enzyme, which is required for the conversion of 21 carbon steroid to 19 carbon steroid. And the granulosa cells have a major enzyme which is called aromatase, which is not found in the theca cells. Now this yellow box is showing the theca cell, and this is the granulosa cell. These two cells are divided. These two cells are divided by a basement membrane. The LH binds to LH receptor in the theca cell, and which allows the activation of star protein. This star protein is responsible for the transport of cholesterol inside the theca cell, and then under the effect of P450 side chain cleavage enzyme, it gets converted to pregnenolone. Then with the help of P450C17 enzyme, the androgen production will take place. Now this theca cell is lacking the aromatase enzyme. So the androgens will diffuse to the granulosa cell. Here, under the presence of aromatase enzyme, the androstenedione will convert to estrone and estradiol. Now, after the rise of estradiol level, there will be a negative feedback to hypothalamus and pituitary, which will lead to a decrease in FSH level. This decreased FSH level will lead to selection of a dominant follicle. Only those follicles which have the largest number of FSH receptor and which have an enhanced FSH action, they will become dominant, and all the other follicles will become atretic. The sustained rise of estradiol greater than 200 picogram per ml for a period of around 50 hours. This will lead to a positive feedback on hypothalamus, and this leading to LH surge and ovulation. It is only in the late follicular phase that granulosa cell will acquire the LH receptor. Now, what happens in PCOS, polycystic ovarian syndrome? There is increased FSH and LH ratio, insulin resistant and hyperinsulinemia, which will lead to theca cell hyperplasia. Theca cell hyperplasia will cause more androgen production, and because of the relative aromatase deficiency. This hyperandrogenism will lead to follicular arrest, anovulation, and infertility. Thank you.
Thank you, Neha, and I think it is quite good in understanding the two-cell two-gonadotropin theory for any practitioner, how to maintain this steroidogenesis, how to manage this steroidogenesis, and what is the significance of steroidogenesis in menstrual cycle. If you understand this, then you can manipulate this steroidogenesis according to your two-cell two-gonadotropin theory. And our main aim is to produce a
good oocyte,
good quality M2 oocyte. We should give good quality M2 oocyte to the tube or to the embryologist, so that there should be a pregnancy. And if you can understand this steroidogenesis and two-cell two-gonadotropin theory, the things becomes more easy to control the activity within the ovary. Maybe the lady is having regular menstrual cycle, or you are inducing a anovulated lady with polycystic ovarian syndrome. Thank you very much, everyone, to join us. Thank you very much, Shalini and Neha.